Yeah, Walter.
Regarding the question of age of onset and temperament versus anxiety disorders, in the Kagan study, I think you said that roughly 3/4 of the people lost their original assessment for temperament, and they must have become something else. They didn't just end up without temperament. So they lost the late onset temperament appearance, so to say. It's different than the one that they had before. And sort of in a related question, when we talk about stability measures for temperament, I apologize for being just a simple country folk type of person, but what's the difference between a stability measure and test-pretest reliability in relation to your question about measurement error and whether you had low correlations between the anxiety and the temperament measures because they were not overlapping concepts versus were there measurement errors that accounted for the modest correlations? But don't they both come to the same thing?
Yes, they do. Well, no, because you would expect that maybe I'm probably the simple Australian folk here, where the test-retest reliability is it's measured in the same way. That it's a correlation between measures over time. But I guess we're assuming with stability. When I'm talking about stability, I'm talking about hypothetical stability. I'm talking about the fact that there's a hypothetical construct that has a certain consistency over time, that changes over time, as opposed to the fact that at any given time there is a measure of the construct plus error, and that the degree of that error will mean that the correlations across time may not be will not be the same. If you took the same measure at the same time, you would find that the correlation would not be unity either because of the measurement error. Is that not right?
Yeah, but since you're taking them over a series of times, it seems to me that the principal difference between the two is that the interval that separates testing when you're looking for stability might be longer than the interval that you might use for test-retest reliability. But in both cases, you have a very difficult time sorting out the difference between error variance and variance due to the fact that the person owning whatever it is that you're measuring has changed in some way.
Yeah.
And so,
that's true.
If you're looking at your optimal stability measures were in the range of 0.5 to 0.6, which were about the same as the correlations between measures of temperament and measures of anxiety, of disorder.
Mm-hmm.
And so if you treat temperament measures at time A and time B as having this big error component rather than differences in stability, then why wouldn't you end up saying the same sort of thing, that you actually do have large error variance in your disorder measurement as well as in your temperament measurement, in which case it wouldn't be surprising that you have non-overlapping. You have people that have high scores in one and not the other. That's what those correlations are.
Yeah, yes, I'm not sure we disagree. I guess I would be saying, yes, it may well be a result of poverty of the measurement, that you've got error within your measurement, and therefore the low correlations may not indicate they're separate real constructs, but rather that you're just measuring it with a lot of error. I'm not sure I disagree. I guess I was smiling because I guess the disagreement is purely that I'm playing a devil's advocate sort of position of saying, yes, look, these are different things, but I'm not totally convinced they are. And it's because of things like that. Yes?
Your argument such that the distinguishing factor between temperament and social anxiety disorder is for temperament you have with the measures that they use to assess these things, you have good behavior for temperament and more internal factors for social anxiety. Yet when you were talking about social anxiety disorder, the research that you cited in the teacher report, and I was wondering how valid teacher's report would be in making the assumption that these two are actually separate constructs.
I thought teacher report is typically, was there one study which talked about teacher report of both was? Oh, it was the Copeland study, right. That's a good point. A lot of people, well, again, it depends whether you think of these as separate constructs or not. But I guess in the disorder literature, a lot of people question the validity of using external reporters like Teacher Report to assess internalising symptoms. And so you're right, there's a question about validity. I guess I would raise the same question about measures of shyness as a temperament, but yes, but yeah, in the disorder literature, you're right, people would question that as whether they're valid or not, because by definition, they say they're more internal sorts of experiences. Yep.
Just sort of a developmental question on temperament measurements, although I do, they all tend to be a lot of other reports, and that's a difficulty anyway, but do they really differ in how they characterize temperament and the symptoms or characteristics of shyness over across age? Because some of the early questionnaires about temperament are really geared towards very young child behavior and regulatory behaviors. And do those change as an adult? So you may have a shy temperament or a difficult temperament, but you now exhibit that differently. Are they different?
The measures across different ages.
Different kinds of, I'm not familiar with
It's probably better to throw that to my developmental colleagues who measure this stuff all the time, because I don't. But my understanding is, yes, they differ quite dramatically, and the temperament types that are identified also differ across ages. And I think the measurements are also, yes, quite different. So is that right? Yeah, people are not, yeah.
People tend to talk about personality rather than temperament.
Right.
So they find that can be mapped on to the earlier temperament factors that nobody agrees on how to define it.
Because you're no longer then relying on that parental kind of report of those factors. You're now relying on the adult self-report or the child self-report when you get older. Are the differences there as well?
The differences are there, but I'm not sure if that's the reason.
It's just one of the factors.
Yeah, there's things called openness and reasonableness that don't necessarily relate to how it is for a young child behaves, but that you maybe have predictors that are like have more subtly.
I didn't catch all that. All right, is that one more?
Just one more quick one. A lot of this is looked at kind of phenomenological differences between anxiety disorders and temperament. I guess what I'm wondering is, do you have a sense of, phenomenology is interesting, but really at the end of the day we're kind of interested in etiology and then ultimately what we do about this. If you had to speculate etiologically, developmentally, do you think temperament and anxiety disorders are different at that level?
Well, that's why I keep grappling with this issue. So, to an extent, when I think about this stuff, and this is the first time I've talked about this in public, as you can tell, the fact that I'm not really clear on a lot of this, and it's because I keep going back and forth about whether these things are different, whether they're the same, and the key question then comes down to who cares whether they're the same or not? And I think what it comes down to is, well, who cares is because we then have questions about do they have the same etiology? Are they the same things? And in terms of etiology, people talk usually about temperament being one of the causes of disorder. And if it's one of the causes, and if it's a risk factor, then the assumption is they're different. And if they're not different, then it becomes very circular to say it's one of the causes, it's the same thing. And so it's a long way I guess, of getting to your question of do they have different etiology? I'm not sure, because I'm not sure if they're different, or I'm still, my jury's still out on whether they're really different or the same thing. There are many days when I just think, look, they're really the same thing. We're talking about exactly the same thing. Disorder is just a manifestation of extreme levels of temperament with some particular arbitrary cutoff, in which case the etiology is the same thing. There are other days when I think, no, temperament is some basic biological process that's inherited and comes in, and that's got a very clear etiology, and disorder has all sorts of other components involved as well. I'm not sure is a very long way of answering your question and a very vague way of answering it, but I'm not sure what the answer is. Okay, I think that's it.